Today I'm going to just briefly talk about 6 points relating to our e-learning policy at the Faculty of Health Sciences. Firstly, I'll discuss a little bit of context and tell you what the layout of the land is, how we use the technology, some of the tools that we use. I'll tell you the 4th point, some results relating to our little video podcasting project with the second years, some challenges that we have encountered en route, and then finally share some conclusions with you. Firstly, let's look at the context in which our e-learning policy resides. At the Faculty of Health Sciences, we started developing an official e-learning policy this year, 2012, in January. Although there are electronic facilities such as Blackboard, Moodle, various websites, isolated e-learning projects, and electronic access to many journals and databases, the faculty needs a holistic approach to using e-learning and to embedding it in the way both lecturers function and students learn. The policy needs to support lecturers as well as students, and often I find that the lecturers get very excited about the technology, but students are left in the dust. The approach we have taken is broadly threefold. Firstly, synchronous lessons, secondly, asynchronous lessons, and thirdly, concept mapping. And I will not be saying anything about concept mapping in this particular talk. We have students both on campus in the faculty as well as at remote locations hundreds of kilometers away from this site. The students in remote locations interact with the lecturer live over the internet using virtual classrooms. These live or synchronous lectures are also recorded as video podcasts for the students to later download for revision, or if they perhaps missed a lecture. The virtual classroom software that we use allows instant messaging, two-way voice communication, two-way video sharing of your desktop and programs, as well as collaboration of the shared content. Giving synchronous lectures does have its challenges, and I'll point out some of those later on. Most of the lectures given to students on the main faculty site are in PowerPoint format, and we use Camtasia Relay to capture these as videos along with the audio from the lecturer. We try to encourage all lectures to be podcasted, whether they are synchronously broadcast to the students or not. The podcasts are converted into a small file format, namely MP4, and placed on our learning management system, which is Blackboard, for students to download. Many of the podcasts have a table of contents on the left, as you see in this picture. That allows students to click on a relevant topic and be taken immediately to that particular spot in the lecture, so they don't have to scroll backwards and forwards to find the area of interest. We use 2 main tools in our environment, the first one being Microsoft Lync. The university has standardized on Microsoft Lync for use by teachers running virtual classrooms. In other words, you provide synchronous lectures to remote students. Lync is able to record the lesson as a Windows Media video file, and our staff download these from the local hard drives, which are mostly in Tygerberg Hospital, and we convert the WMV files to MP4s before uploading and storing them on our Blackboard learning management system. The other tool that we are fortunate to have use of is Camtasia, as university has adopted this as the standard bit of software for recording podcasts. Camtasia comes in two formats: Camtasia Studio, which is a fully fledged video production suite and integrates into your PowerPoint slideshow, as well as Camtasia Relay, which really just records what is on the screen along with audio, but does not have any editing capabilities. We started using Camtasia Relay to produce video podcasts for our second year students in January of this year, and we are going to do this for all second year lectures during 2012. I'd like to now just share with you some of the results that we found with our pilot study with the second years. We knew that podcasting lectures was shown to be of benefit, but we wanted to determine a number of things. Firstly, whether the undergraduate students found podcasting useful in addition to lecture attendance, whether podcasts influenced the examination scores, and whether lecturers experienced podcasts as not being too obtrusive. After the end of the 6-week block, we got both lecturers and students to complete an anonymous questionnaire, and were quite surprised by the results. 88% of our students used podcasts for clarifying concepts not fully grasped in class. This is different from what was found on the main campus. Our main campus colleagues have found that their students use it mostly for revision and examination preparation. Our students, however, because of the specific structure of the 6-week block, where everything relating to an organ system is crammed into those 6 weeks, and they have an enormous amount of information to consume, they found podcasting extremely valuable because they could revise the lecture as many times as they needed to in order to grasp concepts. Now I'd like to share with you some of the challenges that we came up against. In South Africa, we have problems with internet connectivity, specifically the cost of bandwidth, the speed and reliability. Although we're installing 4 megabits per second lines in all our remote hospitals, synchronous lessons remain a challenge. We have found that we can stream voice in both directions simultaneously and a lecturer's PowerPoint slideshow, but we do not have the bandwidth as yet to stream live video of the lecture and students in both directions simultaneously. Hopefully this will improve as costs decrease and the service becomes more stable. The Faculty of Health Sciences is linked to Tygerberg Hospital as well as other remote primary care hospitals such as Worcester, Ceres, Swellendam and Robertson. The faculty relies on clinical staff for a lot of tutorial and lecture input. These clinicians are extremely busy with an enormous patient load and have little time to attend training or pay more attention to acquiring new e-learning skills. Obtaining copyright clearance was also an issue. Copyright clearance for video podcasting is separate and different from copyright permission for distributing material using PDFs or printed lecture notes. Doing this for 20 or 30 lecturers every 6 weeks can be an enormous administrative task. Equipment maintenance is an ongoing issue as batteries wear out, PCs mysteriously stop functioning, and networks just don't work. This is a full-time job requiring a dedicated individual. And finally, some conclusions. Creating an e-learning environment requires a multi-professional team approach. In our circumstances, video podcasting is extremely successful particularly so where entire organ systems are covered in blocks of 6 weeks and students suffer from information overload. They find the podcasts extremely beneficial for revising the lecture material and understanding concepts they did not grasp in class. We are continuing to podcast the rest of the second year lectures and producing DVDs for the students on each of these blocks. This is at their request, as they want to be able to use the DVDs and podcasts to revise their lectures when they get into their clinical rotations and begin to see live patients. Thank you for your time and attention.